Hi, my name is Melissa and I'm a student at the University of West Florida in the Bachelor's of Nursing program. I chose this major because I'm interested in the medical field and helping those who are ill and in need of support. I plan on being a neonatal and pediatric nurse in the future and working in the intensive care nursery with babies. In a program like this, you may expect to take courses such as medical surgical, psychiatric nursing, OB and maternal health and newborn, community health, research, and pharmacology. In the medical surgical classes, we typically learn about all the systems in the body and what goes on and what can go wrong. We'll go to the local hospitals and go on the medical surgical floors and get patients, and we take care of them, give bed baths, give meds with our instructors, and other fun things like that. In the psychiatric nursing, we will go to the psych wards and assess patients and learn all about the mental health process. In the OB and maternal health, we will get to see deliveries of babies, any women's health problems. In community health, we will actually go to homes that need health information and things like that, and learn all about the different dynamics of families. In the research, we use evidence-based practice nursing, which is where we will go online and find articles and apply it to what we are learning in the medical surgical classes. And in pharmacology, is just that. We learn all about the pharmaceutical drugs and what happens in the body for it to respond to an illness. In the last 8 weeks, we go through what we call a preceptorship, and that is where we follow a nurse in the field of our career choice. During that time, as we follow the nurse, we're involved on hands-on patient care, and we will do things like give meds and do procedures such as inserting IVs, inserting bladder catheters, which is the tube that goes inside the bladder to drain urine, and any invasive procedure that they will allow us to do. My favorite part of the program is the actual hands-on experience that I've got in the hospital. After learning all of this in the hospital, I learned that I want to work with babies, so I finally found my destiny and calling of what I want to do with my nursing career. The hardest part is obviously the academics, and all of the classes are hard. You need to expect to take very hard tests and dedication to study to continue in the program. We take standardized tests throughout the program to maintain our competency of whatever we learn from day one all the way up to the end, which also prepares us for the big licensure exam to get our license to practice. My final advice is that I encourage you to volunteer at your local hospital on a medical surgical floor to make sure that nursing is right for you. Also, it is very important to keep your grades up throughout high school and your prerequisite courses prior to entering the program, because it is very competitive to get admitted into a nursing program.